Welcome to Healthcare IT Today. I'm John Lynn, together with my colleague and friend Colin. The world of technology and healthcare are ever changing in new and novel ways, and that's why we love this stuff. So join us as we discuss the latest healthcare and health IT news, meshed together in new ways, which help generate ideas and new perspectives. Plus, we'll have a little fun along the way. Today, we're going to be talking about healthcare costs and dissatisfaction. Today's episode is sponsored by Pure Storage, the data storage platform that grows with you forever. Learn more about how Pure Storage supports healthcare at purestorage.com/healthcare. And be sure to follow the show on social media at the hashtag HITSM and our personal accounts at TechGuy and at Colin_Hung. Plus, check out our 19 years of health IT content at healthcareittoday.com. Well, brand new year. A lot's happened in 2024. It's always fun to read people's insights, perspectives. I think 2024 was a rough year for many, with many people trying to find the silver linings.
Yeah, I mean, there were a lot of silver linings. I mean, I didn't think 2024 was that bad, but certainly healthcare was in a lot of mainstream media news in 2024. There was a lot happening that the general public took an interest in healthcare, especially well, obviously with the shooting that happened recently, and all the controversy that has stirred up. But um,
Yeah. I saw
but I
someone
think at the
say, is this the new normal we thought we were experiencing in 2021, but hadn't quite arrived? And I think that's probably pretty accurate. It's funny you say it wasn't that bad, but when you see the wave of firings of different companies and people without a job for a year, some of that, it's hard to see, it's hard to take and how to process, right? It depends on which industry you're in, right? If you're an AI expert, a data expert, you have plenty of jobs. But if you're a journalist, if you're even a lot of marketing people, PR people, it's pretty tough.
Yeah, well, here's to hoping 2025 will maybe turn around quickly for all of us, and that we won't be talking about these things come the end of the year. But one of the things that I think is consistent, regardless of what year it is healthcare costs, right, John? They always seem to be rising. So my question to you is, are the rising healthcare costs actually sustainable?
It's funny you described it that way because, as a startup, you want that hockey stick growth curve, right? But healthcare costs have kind of almost had that hockey stick growth curve, and it's scary and it's hard to process. And I always, yeah, man, it's one of the most common lines I hear at a conference. It says, "The rising healthcare costs aren't sustainable." And I've always thought whenever I hear that, I'm like, what's gonna stop it? Like we pay for healthcare regardless of the cost, and employers do, we do, because we want whatever care is there. So I think that's the struggle for me with this question of, are these rising healthcare costs sustainable? Well, I think it is sustainable because we will keep paying for it, but it's going to have detrimental effects because they keep rising and the costs keep rising. And so the question is, when will those effects be so bad that we finally say enough is enough and we have to do something about it? What do you think?
Well, so I think there are. I don't think the costs are sustainable, but I caveat that by saying I don't think that the rise. I think the rising cost of labor. I think the rising cost of equipment. Those are natural costs, right? Things just cost more. I mean, and especially in our inflationary environment right now, it would be ridiculous to think that we could pay people less to work in healthcare or spend less on equipment. I don't think those. I think those are sustainable. The rise in costs of those, because that's common for everybody across every industry. But but where I think costs are not sustainable is that there's a lot of unnecessary stuff in healthcare. A lot of middlemen, a lot of unnecessary treatment, unnecessary tests, medications that maybe are costing way too much when there are cheaper alternatives. I think there's a lot of that stuff in healthcare that should be removed, can be removed, and that is making healthcare unsustainable. If it was just the cost of equipment and labor, I think it'd be okay, right?
Mm,
But there's all
that's
this other stuff, right? That makes it unsustainable. So that's my take on it. That's why yeah, I just don't think. To your point, though, I think it'll reach a point where we just, can't take it anymore, and then we'll have to do something about some of these things.
I mean, what is the alternative if healthcare costs aren't sustainable? Maybe we need to look at the rural health environment to understand it. When costs are too much, then there's just no hospital there. Like that's literally what happens. They're just like, well, I guess you're not getting a hospital. You're driving the 2 hours into, the big city to go get care. And it's like, is that what's going to happen? Is that the smaller organizations are all going to just disappear, and then the larger organizations are going to run healthcare, and we're going to have a 3 month wait list because there's just not enough, people to provide the services that we need? Like, that feels like the path that we're on. And sure, if you have the right money and the right connections, maybe it works out okay for you. But if you don't, then that's a problem. So it's like, where else do we go with this? As far as, if the costs keep rising, then all of these healthcare organizations have to face hard decisions, and probably cutting care, long time frames. I mean, that's the result of not having enough costs, I think.
I mean, that's the thing. Like, there's costs on two sides, right? There's costs to the organizations to run themselves, and there's costs to patients.
Mm.
So, on which side does the cost become unsustainable? Like, what you're talking about is the costs on the provider side. And you're right. Like, if it becomes unsustainable to have a hospital in a rural location or a big facility, forget a hospital, just a large clinic in a rural location, because there isn't the volume, or the patient population there can't support the type of procedures and treatments that you offer, well, then yeah, I mean, that's just market forces, right? Unfortunately, you will have to move it and go to a place where it is more sustainable. Um, but you're on the flip side, you're right to say, well, what about those people? Right? What do they do? And the answer is, well, yeah, you'll have to drive 2 hours, or maybe that spurs a growth and some sort of telemedicine version of those kinds of things. So um, but I think where there's more discussion is the costs on the personal side, right? On the patient side. That, healthcare, when it becomes too costly, you don't partake,
Yeah.
right? You forego the care, right? And just go, okay, well, I won't go to that appointment. I won't do that treatment. I won't listen to my doctor's recommendation and go for this or that. I'll just skip it. And that becomes, obviously you're building up health debt, right? That you're going to have to pay down the road.
Yeah, I was going to say, long term, that actually costs more, as we've seen in so many instances where, you don't address your diabetes early, and now you become an expensive diabetes patient that, obviously costs a lot more than if we would have done the wellness visits to avoid the diabetes for another decade, or whatever it might be. The other side that, and maybe this is why healthcare costs is such a mess, that there are too many sides to this, right? There's the payer side, which we haven't even talked about. But the other side that I find so fascinating, and it feels like it's coming to a head, the discontent of the employer. The employers are the ones paying for this, and the costs that associated with healthcare are just huge for an employer, that it's hurting their bottom line. It's hurting the innovation that they can do. Ironically, you look at the cost to the employer, and most of the time they're like, well, it's easier to increase revenue than it is to decrease costs. But at some point, does that not become true for healthcare? Or does it, like many organizations are doing, many employers are saying, why are we paying for healthcare? And will there be this massive change of employers saying, well, maybe I don't need to provide healthcare. It'll go to the exchange. And we see that at the smaller business level. They aren't providing it. And so, I think the employer side is going to be really interesting to watch. We also see, with large enough employers, they're essentially doing direct contracting. Mark Cuban obviously has been one of the biggest advocates for employers really understanding what's costing them with healthcare and how should they, you know, change the model so that they're not spending as much on healthcare. Will that movement go quick enough? I don't know. It'll be interesting to see because again, it is easier to increase revenue than it is to decrease costs, especially costs of healthcare. Because, if you're an employee and your employer says, hey, by the way, we're getting rid of health insurance or we're going to reduce it, that's pretty damaging.
Yeah, I mean, you're not wrong. I think, and you point out to, one of the big reasons why there is so much cost in healthcare is the number of players in healthcare, right? You got employers, you got individuals, you got payers themselves, you've got healthcare organizations. There's too many. Some would say too many fingers in the pie, and each wanting their own slice of that pie. So naturally, there's a lot of profit taking that can happen, right? And which can unnecessarily drive up costs. But I think that, there are some other factors that are not the fault of any of those that are driving up costs in healthcare. One is I think we're just living longer, right? Like,
Mm.
the average age of a person now is by like 20 years longer than it was a decade ago, like, than a few decades ago, right?
And the
So when you
expensive years.
Right. And so the older you get, unfortunately, there's more health complications and multiple conditions and chronic conditions. So you cost more, right? When you live longer. So I think that's one. The other thing I think is our lifestyle, right? Like before, we were pretty active when we were all working on the farms, right? And we were all doing manual labor and things. And obviously our lifespans were all a lot less too, but now we're a lot more sedentary. We eat a lot more processed foods and those kinds of things. So I think all of those are contributing to worse health conditions. And so, yeah, we're costing ourselves, as well. So, you know, yes, can we do better job at that? Yes, but whose job is that? Right? Like it's not an employer's job to mandate what you eat and how much you exercise, nor is it really a payer's job to do that. So, yeah, I mean, I think those are factors too that, you can't lay the blame for that at the feet of, the payers and the health industrial complex.
Yeah, I've always wondered that when I see the chart. We all know the chart. The U.S. compared to every other industrialized nation, and that we're spending 10x more, whatever the number is, right? Like we're spending so much more on healthcare, and we're getting worse results, right? That our lifespan's 72, whereas theirs is 76, or whatever, right? You've seen the charts, right? That look at it. Whenever I look at those charts, I'm like, is that because of our healthcare system? In my mind, I always look at it and I'm like, well, yeah, you're comparing us to Europe or Japan, right? That has higher quality food, that eats a Mediterranean diet. We know that that's more healthy than the diets we do here, than the fast food, the processed foods, etc. To your point, we're somewhat of a gluttonous society in the US, and our prosperity is bad for our health, if you will. The fact that we're so prosperous and that we're so gluttonous as far as the way we celebrate, the way we the way we eat, etc. To me, that's what that chart says. It's not so much that the care we're receiving in healthcare organizations is worse, or even that it costs more. That's kind of a separate discussion, I think, as far as why we aren't living as long as some of the other places. I don't think it's the healthcare industrial complex's responsibility, unless you argue the fact that, oh, why isn't it addressing our health? But that is the reality of our current system, is it's addressing our chief complaint. It's not addressing our health. And so you could argue like, oh, we just need to gut the system and really address the health. Or I think I've argued on previous episodes that we should really create a new system that addresses our true health and wellness. That would be a bigger facet. But then when you look at the costs and what's costing it, I think your previous point as far as the middleman is what's costing healthcare so much. People show the rise of administrations. That's administrative burden, but I think that's still small compared to the PBMs of the world that are in the middle profiting, compared to, the health insurance companies, compared to the pharma, et cetera, all of these people that are profiting from the dysfunction of the healthcare system.
No doubt about that. And hey, if you're just tuning in, you're listening to Healthcare IT Today with John Lynn and Colin Hung. Today, we are talking about dissatisfaction and healthcare costs.
And before we continue, I want to take a moment to thank our sponsor, Pure Storage. We all need a data platform that is reliable, efficient, and manageable. Data is growing and requirements are changing. What feels sufficient and efficient today may not be tomorrow. Just like our own personal health, it's important to routinely monitor your IT infrastructure. That's why Pure Storage has created a quick quiz to help you start a conversation about whether your data platform is future ready. Or maybe it's just time for a checkup. Go to healthcareittoday.com/pure storage to take a quick self-guided quiz and start a path to more reliable and flexible data services.
So, John, I think it would be a sort of oh crap, an understatement to say that there is dissatisfaction towards healthcare right now.
Well, I mean, obviously the elephant in the room was the United Healthcare CEO getting shot down, right? Tragic story, tragic thing to happen, which raises a lot of questions about a lot of different things, and not the least of which is, why was the response to this tragic situation what it was, which was many patients saying, yeah, well, the dysfunction in the healthcare system is so bad, this isn't that surprising. Tragic, but not surprising. I mean, what a crazy thing to happen, and really sad. I mean, it's just unbelievable that it got that bad that someone felt that that was the appropriate response. And yet that's how many, and we've seen it from, after that incident, we've seen so many patients, so many loved ones of patients come and tell their story about how, and not just United Healthcare, every healthcare organization has had some sort of tragic situation where they denied care, or whether they couldn't get a prior authorization, or whether they couldn't get into the doctor because there were too long wait times. I mean, all of those things creates this dissatisfaction, and when I look at it, I said, okay, well, where does all this lead? Is this going to wake up organizations to the fact that we need to do something different? And you
Mhm.
look at it and you say, well, who can do that? Right? Like, that's what's interesting to me. Like, it goes back to our previous conversation about costs. There's so many organizations profiting from it, and so many hands in the cookie jar. Who can really make that impact? And I think that's the trouble. That you can't just, there's not just one organization that could say, hey, we're going to improve this and it's going to solve and it's going to be better. In Canada, maybe it is. I don't know. If you have a single payer solution with a government organization, maybe you do have more. But in the US healthcare, there's so many hands in it and involved in it. That's the trouble. So to me, unfortunately, I think we're going to see more dissatisfaction ahead, because I don't see us simplifying the system. That would be probably the biggest thing that could be done. It would be interesting to see what Dodge and the government initiatives are, because government is obviously the biggest buyer of healthcare and things like that. But man, it's a complex tangle of web that we have weaved in healthcare.
Yeah, and unfortunately, I'm a little bit jaded here, right? Like, you know, I think every year we feel there's a story, an event that is a watershed moment for healthcare, and that the sea change will happen. And unfortunately, it's never been that way. Like even the pandemic, right? It hasn't resulted in some sort of amazing sea change in healthcare, and that was like the worst healthcare event in our lifetime.
Yeah,
Um,
I saw a headline today that said we've forgotten what COVID taught
yeah,
us.
Yeah, so I think unfortunately, I don't think that the tragedy that happened in New York with the United Healthcare CEO is really going to change too much. I mean, I think it'll make some changes, and I think it's raising the awareness, and maybe there's going to be a few more people joining the chorus of voices to affect some change. But I don't think that one event is going to cause a lot of change, other than I think a lot of CEOs at payers are going to be hiring security teams.
Yeah.
um, for the next little while.
How
And that
tragic is that line? You know what I mean? Like that the
like
only change is that we hire more security. Like that's kind of
yeah,
sad.
and to your point, it was a very extreme reaction to something that's happening, right? Like that is not the appropriate reaction to, to that kind of tragedy, or whatever story is going to emerge, right? From that person's history. But what I do think it is going to do, what all of these things do, is build up the number of voices, right? So
Mm.
someone out there is going to use this story to personally motivate them to make a change. And that person may found a new company, may become head of a payer one day, and maybe make some change. I think that is what I think is the long lasting change that can come from this. Someone is going to be so outraged and channel it really, really well to do something about it. And then,
Mm.
maybe a few years from now, we're going to start to see some results of that. But I don't think this is unfortunately going to be a watershed moment for healthcare.
Yeah, I mean, I think the hope that it gives me is that it provides more transparency into what's happening. And that has kind of been healthcare's MO is if we make this complex enough, then they won't know what's really going on. That's why we get charged $200 for an ibuprofen in the hospital, right? Like it's because you're not paying $200 for the ibuprofen, you're paying $200 for the overhead and for the charity care that they give and for all, it's this complex system that is so complex that we just stop asking questions. And this has forced a lot of people to say, no, let's ask the questions that need to be asked about this. And so we can understand what's really going on. And we'll see. I saw an interesting report on the pricing transparency, and it was the penalties that were doled out to healthcare organizations because they weren't being transparent in their pricing, which is the law. But you looked at it and you're like, it was like 0.002% of their revenue. It was the penalty. It's like, okay, so that's not a meaningful enough penalty. Now that's just a business decision for that healthcare organization to say, oh, I guess I'm paying a $5 million tax to not share my pricing, which is much cheaper than actually sharing it and then having to deal with the backlash of why is it priced this way and why is it that way. Now we'll see how does that evolve, because I think a lot of people are saying, hey, we're going to dig into this and let's really tell the stories of the patients that are suffering so much that they would go and kill someone. Like that's the feeling that they have. Like let's dive into that and understand it. But the other thing that's beautiful is we have the technology now, and we have the ability to communicate these stories and to understand at scale what's some of the impact. So the data is actually out there to be able to tell these stories. So I think that's the other part of the technology side of things is, hey, the technology is there to understand how this is being done. Now, untangling it's going to take a while, and those stories are going to, you have to do it. I go back to, the biggest thing is that politicians are all about popularity. And with so many people profiting from healthcare, they don't want to change healthcare because they're going to impact the people that are electing them. Whether it's the person working at a hospital or whether it's the person working at a farm organization or for a payer, let alone the donors that support them. Like that becomes a tricky thing to say, hey, let's cut healthcare costs in half. Every person in the US is like, yes, let's cut the US healthcare costs in half. But then they're like, well, how do you do that? Like, where would you start if you're like, okay, we want to cut the healthcare costs in half? What would you start to lower healthcare costs?
That's a that's a very complex question. I mean, the easy thing to say would be eliminate all the middlemen, but I think the harder question would be what purpose did those middlemen serve, and where else could that purpose be served, right? Like
Mhm,
we all hate PBMs, or we not well, no hate them. We don't understand. A lot of people don't understand even what they are, why they exist, but they existed for a reason. They are there for a reason. So can we figure out a way, a cheaper way to deliver what they deliver? I
mhm.
think is a good place to start. I think unnecessary tests, right? We hear this maybe not as often as before because with interoperability slowly getting better, but there's also I call it the CYA test, right? Well, you got this test done at this other facility that's not in my network, and hey, well, you know what? I'm gonna have you redo the test because I want it from my lab and my trusted partner, and so I'm just gonna have you redo it even though this other one is perfectly valid, right?
Yep.
And the only reason why they're doing that is because the potential is there's something they missed, and then I base my decision on that, then who gets sued, right? So I think that kind of stuff can be removed and those unnecessary costs. That's a first step. I mean, I don't know how much it'll take out, but I think that's a very easy thing to do is to say, okay, let's fix that problem.
Yeah, that's an interesting one. You're right. That would help a lot of things. I always love the doctors who come and say we're not the problem and show some graph of the growth of administrations and things like that. I think they're not wrong that like you said, the middlemen, the administrative people who are just trying to deal with regulation. So maybe that's where you start is deregulating some of the things that are just adding costs and burden to the health system, which would then hopefully reduce the number of administrators needed to administer the healthcare system as it was, right? So, if the reimbursement and regulatory environment is so complex that you need a whole mountain of staff to deal with it, well, that's a way you could cut costs. But again, you got to go back and say, well, why was that regulation put in place? What was the reason for it? And how can, is there another way to do that? Or do we not need that anymore? I heard that about government. It's easy to make policy, it's hard to take it away. And that's true. So I think that's interesting. The one I would love to see, I would love, and I don't understand this fully, but I would love for us to see, okay, well, how much is pharma charging every other country? And let's do an average of that price and then let's pay that. Or something along those lines, right? Like this says, and unfortunately, it will screw the other countries because then all those other countries are going to get higher prices because of it. But like that pharma bill would change completely. Now it's probably untenable that they'll actually pass it because pharma doesn't want that because we're subsidizing the rest of the world in many ways with the higher prices. So, I think that's the trouble. But, something like that, if we had enough transparency into what was happening, maybe it could get enough momentum, public outcry to do something. And it would be interesting to see, would that lower the cost of things like pharma? Uh, you know, it's a tricky thing though. You even look at the high cost of cancer drugs or whatever drugs that are that are really expensive. You're like, well, should they cost that much when they only cost $1 to create or $2 to create? It's the eternal discussion of, well, they use that for R&D and things like that. So I think that's where it's a tricky discussion. But going back to what you said, it's the middleman. But it's understanding why are they profiting it and what are they serving. That really is the key to lowering costs.
That's a lot of stuff on costs and dissatisfaction, John. And thanks to all of you who tuned into this episode of Healthcare IT Today. And I also want to take the opportunity to thank today's sponsor, Pure Storage. Try the self-guided wellness quiz today at healthcareittoday.com/pure storage. One word. And take the first steps towards a more reliable and future-ready data platform. For more details about our show, check out the programs page on healthcarenowradio.com, and please share your voice and engage with the community at healthcareittoday.com and on social media using the hashtag HITSM. I'm Colin Hung, along with my friend and Health IT collaborator, John Lynn. Thanks for listening and have a great week.